A new law is now in effect. Doctors are not allowed to prescribe more than 3 days' worth of opioids to patients with pain from a temporary medical emergency, 7 days if it's deemed medically necessary. What about those with chronic pain? The law says patients with long-term pain fall under a different category and should not be affected. But a Spectrum Bay News 9's Lauren Verno shows you tonight. Some chronic pain patients are skeptical and say they are nervous about the law's impact.
Still got those left.
For the last 25 years, this pile of pills
These here are the extended release.
has become a way of life for 70-year-old Gordon Stanhope.
I have been on pain medicine or working with a pain doctor or orthopedic surgeon for so many years that they just automatically classified me as a chronic pain person.
Stanhope fell out of a 15-foot tree almost 25 years ago. Doctors admit treatment for pain back then was very different than today.
Doctors at one point in the early 2000s were fearful of not prescribing opiates to the patient.
Dr. Fabian Ramos is Stanhope's current pain management doctor. Stanhope is one of only 18% of patients Dr. Ramos still prescribes opioids to. And over the years, Stanhope's dosages have gotten lower as doctors try alternative treatments.
The only way to keep a person like me out of pain is to give me enough pills, and by the time you give me enough pills, it'll kill me. So I understand that part, but it's miserable life to have to live that you're in pain 24/7.
Stanhope understands better than anyone why doctors cannot continue to prescribe like they have in the past. His son died of an overdose just a few years ago. Both Dr. Ramos and Stanhope agree they have to find a happy medium.
It has to be a trust that we're going to take that patient to a place where the pain is not going to be necessarily higher and the patient is going to feel better.
Stanhope just doesn't know if that day of compromise will ever come.
It just gets so aggravating after a while. Skip that one.
The future of living day to day with this chronic pain still very unclear. Lauren Verno, Spectrum, Bay News 9.
Now, even before this new law passed, anyone prescribed opioids would have to see their doctor at a minimum every 3 months. How often chronic pain patients will have to see their doctors now will vary on a case-by-case basis.